Some experts in the country have called for an increased tax regime on sugar-sweetened beverages as a measure of reducing consumption of such products. This was as Corporate Accountability and Public Participation Africa organized a national conference on beverages tax in Abuja. Participants say there's a link between high consumption of sugary products and non-communicable disease, which has led to many deaths lately.
More than 30% of all deaths in Nigeria are linked to non-communicable diseases. It is alarming. And according to WHO, the risk of premature deaths from cardiovascular diseases, cancer, respiratory diseases, and diabetes, among others, of people between 30 and 69 is about 22%. As of 2020, about 21 million Nigerians were overweight, 12 million obese, and in our population of about 15 and above. Government should be wary of the industry. The tax reform that should be done relating to XSB tax, public health, is to have a sustainable policy law like other government that will ensure that SSB are taxed to that tipping point that will cause reduction in consumption and protect the health of our people. So we do expect that one of the critical recommendations of the Presidential Committee on Tax Reform should be an increase of this tax and a legal framework to ensure that we don't even need, again, the yearly budget or fiscal document for that tax to be implemented. The scope of the tax should be expanded to include several other products that are not covered, and that there should be adequate sanction for corporations that try to undermine this tax regime.
Implementation of this sugar-sweetened beverage tax will cut excess consumption of these substances and strategically reduce the increased risk of tooth decay and cavity, weight gain, obesity, type 2 diabetes, cardiovascular diseases, chronic obstructive pulmonary diseases, cancers, and other NCDs. The federal government, through the non-communicable diseases division of the Federal Ministry of Health, is very much committed to providing leadership for the implementation of the sugar-sweetened beverage tax in our country, Nigeria.
Take fruits, go into physical exercise. It must not be vigorous one, especially for the adults. You can stroll, you can walk for 30 minutes on daily basis. It will help you. Not living a sedentary life, sitting down in the office and not even moving. There must be room for you to move around. We believe that if we increase that tax, it will reduce the impact. But beyond that, we also put in measures, because there will be consequences for any action. If we say you shouldn't pass a particular level, and you pass that level, there will be consequences to that. Do you understand me? So we have come up with the policy. We are also putting in measures to make sure we enforce those regulations. So they must work together. Do you understand me? So if we tell you don't pass a particular range, and you pass that particular range, because it's going to cause a lot of havoc, especially to the productive, ages in the country, the children, the adolescents. So we need to curb those things. People are coming up, children are coming up, adolescents are coming up with diabetes, coming up with cardiovascular, diseases, coming up with cancers, coming up a lot of, avoidable, non-communicable diseases. Like I said, the country is tilting towards a double burden country, in which case the non-communicable disease is also competing with, communicable diseases. And these are the strategies we can use to reduce. Do you understand me? the burden of non-communicable disease.
Yeah, the 10th Assembly, as regarding health, is committed to any legislation that will promote the health, the well-being of Nigerians. And therefore, we are working with different stakeholders. We just had a retreat on the legislative agenda for the 10th Assembly last week. And then we are building on it, capturing different aspects of health, health insurance, health promotion, and anything that will promote the health of Nigerians and reduce the burden of health on families, on communities is what we are in for. So the 10th Assembly is actually committed to ensuring that Nigerians get affordable and accessible healthcare delivery.